Very, very important information for you today. I'm not sure how many of you saw that interview with Dr. McKenzie, Dr. Bisasor-McKenzie on TVJ. She was talking about the Mpox alert in Jamaica, and she was talking about the amount of cases that were recorded before, and she was talking about the amount of cases recorded in the Americas. So we're not immune to this disease. And whether you want to believe it or not, something is killing people in Africa, in the Democratic Republic of Congo. Yes, we can be sure that pestilences and all sorts of things in diverse places will be with us. All right. The question is, are you ready to take that choke again, or would you be protecting yourself the natural way? That's for you to decide. Either way, there's some valuable information that interview she did on TVJ, and I'm going to bring you some information from that. But before we get into that, I want to give you some information from GIS. It talks about Jamaica heightened surveillance for Mpox. It says Jamaica has heightened its surveillance to detect Mpox to ensure that if cases are identified, they are controlled, says Minister of Health and Wellness Dr. Christopher Tufton. So that is something that firstly we have to pay attention to, and he was addressing a virtual press conference when he talked about this. There are no reported cases as of August 22nd in Jamaica, but due to public health risk associated with a single case of Mpox, members of the public should take the necessary precautions to safeguard themselves, right? He says the government, through the ministry, has heightened its surveillance and notes that the overall goal of surveillance, case investigation, and contact tracing in this context is to break chains of human to human transmission and to stop the outbreak of disease should it be detected in the population. So we're going back over the same issue that we did during the last lockdown. He added that surveillance is critical at this time to rapidly identify cases and clusters in order to provide optimal clinical care, isolate cases to prevent further transmission, identify, manage follow up contacts to recognize early signs of infections, and to protect frontline workers, right? This means that we will increase messaging at our ports and we will interview travelers who have visited countries of interest in the last 6 weeks. Anyone with symptoms will be treated according to our protocols. Persons without symptoms will be issued health alert cards and told to contact the health department if they develop symptoms. So they will be issued health alert cards to contact the ministry if they develop symptoms. That persons who do not have symptoms, right? Once they come to the ports at the airports. Tufton pointed out that there will also be increased surveillance in health facilities as persons with suggestive symptoms and travel history will be tested and treated according to the established protocols. So if you remember the protocols we had during the previous lockdown, remember that it's coming again once there are cases in Jamaica. He said that members of the public are also to advise the health department if they develop signs, symptoms, and where clinicians suspect that a person might be infected with a virus, they must make a report to the health department. All right. So he was talking about the whole issue of ports securing the nation and the protocol that could be taken once the virus is detected on the island. Let's go again. Chief Medical Officer Dr. Jacquiline Bisasor-McKenzie said Jamaicans have the capacity to test for the virus and noted that mass vaccination of persons against the illness is not recommended as for now. The vaccine is for people who have come into contact with people who have been confirmed to have Mpox. So pay attention to what is said here. The chief medical officer is saying that mass vaccination of persons against the illness is not recommended as for now. The vaccine is for people who have come into contact with people who have been confirmed to have the Mpox. So you don't know, maybe sometime down the road, it will be a matter for us to get what? Vaccinated. That's the story. Keep that in mind, right? Let's listen to Dr. Bisasor-McKenzie now when she spoke with TVJ. She had some very interesting things to say, and I want to bring you portions of that interview right now. Let's listen.
This new
How many
type.
cases have we ever reported here? Is it just one that we
Well, so generally speaking, in the region of the Americas, we had over 60,000 cases. and the majority of those were in North America and South America. But in the Caribbean sub-region, we had 107 cases, and in Jamaica, we had 21 cases.
21.
Yes.
It's the pox family, smallpox,
Right,
chickenpox.
right.
It's actually not, and I think I
It's
made an
not?
error
So
in
please-
an interview
okay.
before. It's in the same family as smallpox, but not in the
But
same
not-
family as
Chickenpox.
chickenpox. But it looks
Manifestation
similar.
is the same.
Yeah, because I was going to ask you if you've already had it. Are you still able to catch it again, or does that make you immune to it?
Okay, so at one time it was thought that there was long-term immunity. However, it is evolving. The picture is evolving, and then clade 1b is new, so you don't know. And certainly in the last outbreak, we would have seen repeated recurrences, repeated infections in persons. So yes, there is a possibility that you can become reinfected.
Interesting. Okay, so how do we not get infected in the first place before we even reach reinfection? What do we do to protect ourselves? I saw something there about vaccination. There's a vaccination for Mpox?
Yes, there is a vaccine for Mpox, because remember, smallpox was eradicated with the introduction of the vaccine, and so the wherewithal as to how to produce vaccines for this family would have been there. So there have been modifications of the smallpox vaccine, and so there is vaccine available for monkeypox. But persons that are ill with monkeypox will start developing flu-like symptoms: fever, headaches, muscle pains, joint pains, swollen lymph nodes. And after about 4 days, they will start having the lesions. Once they have the lesions, then the material from the lesions can be transmitted. But also in terms of the droplets in saliva and respiratory droplets, then you can, in close conversation, it's not airborne, but certainly in close conversation, long, prolonged conversation, persons can pass it. Things like kissing, you can pass the body fluids, skin-to-skin contact, sexual contact. Of course, we know that in 2022, it was clade 2 was mostly associated with men who had sex with men, and not just men who had sex with men, but general sexual contact. It was thought to be sexually transmitted, and that is what we're seeing with clade 1b. But clade 1a, we're seeing a lot of contact among children. And so in the DRC, clade 1A is chiefly among children. And this is because of the close skin-to-skin contact, because in that country you have these refugee camps where you have a lot of the children together. So everybody is at risk, because once you have close contact, then you can transmit it to persons. So the precautions are that really and truly persons should maintain their infection prevention and control measures that we have preached over and over from COVID: hand washing, hand sanitizing, physical distancing, are things that you must adhere to. But in terms of close skin-to-skin contact, you should try to avoid that. And safe sexual practices, sticking to one sexual partner, using condoms. These are things that persons do not share, things, because not just person to person, but also you can have infected material like bedding, clothing, towels, that the virus will remain in for a short while, but you can transmit using that as well. And then from mother to the fetus, you can have transfer from mother to baby while the baby is in uterus.
So you heard what Dr. Bisasor-McKenzie had to say. Pay attention